So you're thinking about spending your golden years in Southeast Asia, right? You've probably heard all the amazing stories, the incredible street food, the beautiful climate, the unbelievably low cost of living. But let's be real for a second. There's always that one massive, lingering question that tends to keep people up at night. What actually happens when you get sick? Today, we are completely cutting through the marketing fluff in this explainer to give you a straight-talk guide to Thailand's absolute best hospitals, the real costs you can expect, and the insider strategies you literally need to know before you pack your bags. Look, it is incredibly common to fear the unknown, especially when we're talking about relying on a foreign medical system. You might be sitting there picturing massive language barriers or, questionable safety standards. Okay, let's dive into this because the reality is probably going to shock you. Thailand doesn't just offer adequate care. It offers highly accessible, downright world-class medical care that regularly outpaces what a lot of expats experience back in their home countries. But, and this is a big but, you have to know exactly where to look and how the system actually works. Here is our quick roadmap for this explainer. First, we'll look at the gold standard, JCI. Second, the Bangkok heavy hitters. Third, care beyond the capital. Fourth, premium versus local options. And finally, we'll wrap up with some essential expat tips.
Let's jump right into Section 1, the gold standard, JCI.
65. As of 2026, Thailand is home to a staggering 65 JCI-accredited hospitals. Now, why does that number actually matter to you? Because it is the absolute highest number in all of Southeast Asia. It's undeniable proof that we're looking at a deeply mature medical infrastructure, one that's been successfully catering to expats and medical tourists for well over 3 decades. And just so we're completely crystal clear here, JCI, or Joint Commission International, accreditation isn't just some clever marketing fluff. It is the exact same stringent global gold standard that is used to evaluate the top-tier hospitals in the United States and Europe. We're talking about facilities having to meet over 1,200 rigorous patient safety standards, and they get aggressively reviewed every 3 years. Basically, when a Thai hospital says it's JCI accredited, you are getting verified world-class safety. Moving on to Section 2, Bangkok, the heavy hitters. Now, what's really interesting about this slide is the contrast between the two major players you are definitely going to hear about. On one side, you have the world-famous Bumrungrad International. It consistently ranks as the #1 hospital in Thailand, treating literally 1 million patients a year. It is the absolute benchmark for complex, serious illnesses, but no surprise, it comes at the highest cost. On the other side, though, is Samitivej Sukhumvit. Located right in a major expat neighborhood, it has a much warmer, far less intimidating vibe. It's totally perfect for families and day-to-day routine care, and it sits at a much more moderate price point. Let's put some actual numbers on this, comparing moderate versus highest cost using specialist consultation fees. At Bumrungrad, you're looking at about $42 to $70 just for a consult. Move over to Bangkok Hospital, and that drops slightly to $34 to $56. Samitivej brings it down even further to $22 to $50, and you should really notice BNH Hospital here, $22 to $42. It's one of Bangkok's oldest private hospitals, located in the Siloam area, and it's highly regarded by veteran expats for offering absolutely fantastic value, especially in geriatrics. All right, Section 3, care beyond the capital. You definitely don't need to live in Bangkok to get great care. Let's head up north to Chiang Mai, a city that honestly punches way above its weight class for expat medical care. If you've got something highly complex, Bangkok Hospital Chiang Mai handles the serious referrals and is JCI accredited. For a solid mix of routine and specialist care, Chiang Mai Rama is a centrally located favorite. And for budget-conscious retirees who really just need warm service and basic routine care, McCormick Hospital is an incredibly cost-effective ISO-certified option. To really ground this data in reality, just listen to this review from an expat patient who recently visited Chiang Mai Ram for a minor issue. Quote, "In and out in 80 minutes, bill was $19 including the prescription. Excellent value." I mean, wow. That is the actual reality of regional Thai hospitals for you. You get incredible efficiency, English-speaking doctors, and absolute bargain pricing. Done on the coast, though, we see a slightly different vibe. Phuket definitely carries a bit of a price premium. Consults run about $25 to $50 at Bangkok Hospital Phuket, mostly because of its high-end tourist economy. On the flip side, Pattaya offers fantastic direct billing expat care, with consults running $22 to $42. Both are JCI accredited, but your day-to-day costs will absolutely shift depending on the specific local economy you choose to live in. Section 4. Premium versus local clinics. I have to ask you, do you really need a flagship hospital for a headache? It sounds totally obvious, right? But it's a massive, massive financial trap that brand new expats fall into all the time. They just assume that because they live in a foreign country, they somehow need to visit a 5-star luxury medical resort just to get a Band-Aid. So here's the insider secret that veteran expats use to completely thrive financially. You reserve those premium flagship and JCI hospitals, places like Bumrungrad, exclusively for complex care, real emergencies, and major specialist interventions. And for literally everything else, routine GP visits, a minor bug, your basic budget checkups, use local clinics and ISO hospitals. Almost every major city in Thailand has high-quality private clinics that can handle the common cold perfectly well for a fraction of the cost. And this brilliantly illustrates what I'm talking about. Look at the massive difference in those max consultation costs. Going to Bumrungrad for a simple checkup could easily set you back $70. The exact same level of routine care at Chiang Mai Ram is roughly $34. And at McCormick, just $20. Choosing the right facility for the right ailment is literally the ultimate secret to managing your retirement healthcare budget over there.
Which brings us to Section 5, Essential Expat Healthcare Tips.
All right, rapid fire. Here are 3 absolute non-negotiables that will save you massive headaches and some serious cash. Step 1, always bring your physical passport for registration. Your driver's license from back home? It will not work in Thai hospitals. Step 2, get your direct billing sorted out with the International Patient Center early, way before an actual emergency happens. Step 3, and this is a big one, always ask for a paper prescription to take to an outside pharmacy. Hospital pharmacies in Thailand mark up their medications significantly, so literally just walking down the street to a local pharmacy can easily cut your medication bill right in half. $11,000. So, the crucial point is, if you are applying for the standard non-OA retirement visa, Thai law legally mandates that you carry a health insurance policy with a minimum inpatient coverage of roughly $11,000. Do not arrive at the airport assuming you can just skip insurance. It is a hard, strict legal requirement to even get your foot in the door. I really want to leave you with a final thought to chew on today. Are you budgeting correctly for the exact tier of healthcare your retirement actually requires? As we've seen, Thailand offers literally everything from an $8 local clinic visit all the way up to a $70 luxury consultation. The power is completely in your hands, provided you actually plan your strategy before you pack your bags. Thank you so much for joining me for this explainer, and we will catch you next time.